The opportunity to help patients who've been struggling with their weight for a long, long time is one that I value greatly. These patients place a lot of trust in me to guide them, first of all, through preoperative process, and help them get prepared for surgery, help them arrive at a decision that they're very, very comfortable with and that they can live with for the rest of their lives. So I take the entire process really, really seriously and see the effects that we have on somebody's life. It's very rewarding to see patients become more active after surgery, to do things that they haven't been able to do for many, many years, to sense that excitement at post-operative visits, to share in that excitement with patients as they undergo this transformation in their lives. It's extremely rewarding as a physician to see patients come off of their medications for diabetes and hypertension, high cholesterol. It's extremely rewarding as a physician. We put tremendous emphasis on preparing a patient for surgery, give them the information that they need to make a good decision. And for any one patient, there may be a number of very good options. So we talk about the patient's own idea of risk. We talk about a patient's own weight loss goals. And then, of course, we take into account a patient's medical history and arrive at a decision together. And that is my goal for preoperative preparation for a patient, is that they walk out of my office very comfortable with the decision that's been made, and they look towards surgery in a very positive way. I think another strong quality of our practice is that we have a patient advocate who's very, very dedicated to patients and who's been through the bariatric process herself. So having that sort of coach, if you will, who prepares patients preoperatively for surgery, helps patients postoperatively with lifestyle adjustments and dietary advice, I think is tremendously valuable for patients. Bariatric procedures are all done with laparoscopy. It's also called minimally invasive surgery. It involves small incisions rather than making one long incision, which ultimately decreases recovery time and reduces pain postoperatively and avoids wound complications like infections. Health benefits of bariatric surgery are many and include improvement in conditions such as diabetes, hypertension, high cholesterol, all which increase one's risk for heart disease and stroke. It also has a dramatic improvement in diseases like obstructive sleep apnea, gastroesophageal reflux disease, patients who have been struggling with PCOS and infertility. There are benefits as far as decreased risk for certain cancers, so the health benefits are many. All of our patients receive an initial consultation with our registered dietitian, who provides advice on how to prepare for surgery, but also post-operatively how to manage a bariatric diet. We offer patients a lot of support, not only from our patient advocate, from our registered dietitian, and our entire staff is dedicated to helping patients achieve long-term success. And that means, maintaining compliance with a bariatric diet. Support groups are a big part, I think, of a patient's success when they're able to trade or exchange advice with fellow patients. I think that's tremendously valuable. And so we have a very strong social media presence that I think is going to help our patients achieve those kinds of forums where they're able to exchange ideas and information, not only with each other, but with our registered dietitian, with myself. And so there's a lot of communication that goes on far beyond surgery to help patients achieve long-term success.